We have rolled out e-signature in one of our major programs because our funder, which is the state, allowed us to do that. And the other major program right now, the state still says we need a wet signature, though we were able to use verbal signatures, which ask me how that works. I'm not quite sure. For part of the pandemic, I understand they need to discontinue to offer services. And even interesting enough, in state law is very clear that an e-signature in Louisiana is just as valid as a wet signature. We're hopeful to continue to see that. I think beyond that, hopefully we'll continue to see a movement towards value-based purchasing, value-based care, and pay for performance and outcomes. What I'll tell you from my prior work, where we looked at pay for performance and social impact bonds. The key there is to when you tie the payment, you tie it to a very specific outcome. The data is absolutely the most important piece, and how you're going to track and measure the change in the outcome from point A to point B, which will absolutely 100% rely on our medical record systems, our data systems, et cetera. And so making sure that we have accurate pieces of information that are safe and secure and accessible and mineable will really hopefully be the future of our healthcare systems, because we're not going to see a decrease in cost and an improvement of care until we tie the outcome and the payment stream together. If right now you show up with a list of symptoms today, and your doctor's going to get paid. And if you show up 2 weeks later with the same set of symptoms, you're going to get paid again. Until that second payment is not tied to the outcome of the first, or the outcomes are not together, we won't see any real movement in our systems. And then all of that will require a major IT infrastructure and lift for sure.
I definitely think moving forward in the 10 years, next 10 years, telehealth is probably going to make a big jump in advancement, especially in the rural communities here in the Ozarks. I just see this being a good thing for everybody all around. Previously, the state of Missouri had been doing some work towards telehealth that wasn't necessarily all that aggressive as maybe other states like West Virginia, for instance, which had really, really good structures in place. But since the pandemic, there's been a lot of forward movement in that direction, and I see this being something that carries on in the future.
I know Oxnard Health Systems here in Louisiana is one of the innovators in the telehealth space. They even have a kit you can get, which is manufactured by a national organization, where you can take your blood pressure at home and it'll link into the system. They got a scope you can put in your ear and then in your nose, and then it will broadcast that live to your doctor, and you'll see a range of these types of telehealth and intervention. Remote monitoring is kind of the catch-all term, which sounds a little big brothery, but sometimes it's as simple as you self-track things and text them in to where you have a wearable. And of course, all of those things will be connected to Internet of Things, which I imagine will provide some opportunities for bad actors to try to hack and gather information on. So I think the idea of telehealth will evolve from phone call to video to using some at-home devices to transmit information.
What percentage do you guys think in the future telehealth will play as opposed to the in-person visit? Do you think that they'll get adapted in general on a big basis? Or do you feel like once we're all at our normal again, that we'll just go back to going into the office?
That's kind of I guess my answer would be two parts, because it's really going to boil down to the percentage of individuals you serve that are in these remote rural areas where this is going to be a big benefit. And it's also, if you wanted to move forward past that, it would probably have to do with what the percentages are when it comes down to billing. So.
Yeah, I was just kind of made a couple quick notes that, there's the idea around access, which you're absolutely correct. In our rural populations will be key, where they don't have a lot of specialists or doctors. So be able to access some of that interim care. I have a lot of docs that I work with that are hyper specialists, and they say, the time and the intervention they need is between the ears, in the sense of you need them for their mind and their time to be thinking, rather than necessarily doing a physical examination for whatever their specialty might be in. So they're definitely a high user or potential user for telehealth. And to your point, Aaron, it's going to be wherever the dollars flow. Right now, the interesting part of pandemic was where we just turned on telehealth. The reimbursement structure is the same. So if you're getting paid the same for a telehealth intervention versus an in-person, and you can do a telehealth, boom, 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 boom. Well, of course, health systems are going to want to do that. So it'll be interesting to see if there'll be some sort of push to try to regulate that down. I think health systems will make that kind of between the ear argument that, for the most part, you weren't necessarily paying me for that physical interaction anyways. You were paying me for my expertise. Now, there could, of course, be the argument that I was also paying you for the lights and, the scalpel and the tongue depressor or whatever, and maybe I'm not paying for that now. So I think there'll be some sort of moderation in between, but I think the overlay that has the potential to be a real benefit, but also something that could be a slippery slope is that overlay of that health equity, which we've seen is to be so important. So on the one hand, you really can provide an opportunity for underrepresented populations to access care, but do they have the technology that they need? How is the care being delivered in an equitable way through this virtual platform? And what benefits are we losing out on by not having that face-to-face interaction there? But also, if you've got someone who's going to have to take a bus 3 different places and 3 different stops to get somewhere, and it's a 6-hour trip to see their primary care physician, a telehealth, if we provide them with the tools that they need, could actually be a really great way to work towards more health equity.